I mean, to be fair, when it comes to my scarring, my scars are much more visible than any regular scar. So it's just the way I'm healing. My body is creating something that's called a hypertrophic scar. Yeah. So they're, the whiter, wider, slightly raised. They appear slightly larger. So even though my surgeon used relatively small, punch size, which is 0.8 and 0.85 millimeters, depending on the graft, they still look larger than that. And unfortunately, he was not able to go any lower than this punch size, just because the way my graft are growing, they're not like bunching in one, they like growing in one line. So forehair graft would be like in one line. So you need a bigger essentially punch to extract them safely without any transactions. So it's kind of my limitation there. And if we're gonna go back and look at my videos when I bust down, after my second transplant, when I had 6,500 extractions essentially done, you can kind of see pretty clearly. You can see the white scars, But again, I'm anomaly. That's not normal, and the regular patient will have a much better donor essentially after the surgery. You mentioned yourself, with the small surgeries, you're not really going to see any scarring, especially when it comes to if you're going to a good surgeon, which is true. But still, however, I would never, put in a mindset as of that, even you're going to have 500, 1,000 grafts, you're not going to be able to see any scarring. In my opinion, it can be slightly misleading, just because it will be scarring for everyone. Some people heal better than the others, and some people heal exceptionally well that you literally cannot see anything. And it's just, great. But the average patient will have some degree of scarring. And it doesn't matter how many grafts you're going to extract. It's 500 or 5,000. It's just going to be more or less dots, essentially, when it comes to FUE. When I always say to people, expect some scarring, expect to have slightly longer hair on your donor area, because in my opinion that's a really great trade-off, to have slightly less hair here and you're limited to slightly longer hair, like as a hairstyles, but you have hair on the top, right? So that's the whole goal, just to relocate, and that's it. So in my opinion, for me at least, it worked great. I had 7,700 grafts approximately over 3 surgeries now. I was on 5A, like I said, and I mean, I can still go buzz down my hair on the sides to guard number 2 when I go into the barber. So that's pretty low, I would say. You can kind of see the outline, but you really need to know what you're looking at, and just to spot it. Yeah. Any other person on the street will never know. I actually challenge some of my friends, colleagues, whatnot, who don't know that I had the transplants, just to see if there's anything, if they see anything wrong or anything. I just point with the finger, and they looking at it like, what do you want me to tell? I was like, it's hair, So nobody can really see the scarring. Nobody can really tell that I had a hair transplant when it comes to hairline, density, and everything like that. It just looks great. I have slightly less density, I would say, in the crown, just because, a crown, exactly. It's a black hole. Regardless of amount of grafts you're going to put, it's always going to be not enough. So it's the same case here. Once I had really thick, mid-scalp and going towards the crown, and then the actual whorl just becomes a bit, thinner. So as maximum people think is that, well, I might be losing hair just because it's slightly thinner on the crown. Yeah. That's it. So, in my books, that's a win, because I was totally bald on top. So, I'm pretty happy.